Today, we're going to learn about the last vital sign, which is blood pressure. And so, my goal for you is that you'll understand what a blood pressure is and the difference between systolic and diastolic readings. And you'll also be able to practice listening to the carrot cough sounds, which is the heartbeat you hear when taking a blood pressure to determine what somebody's blood pressure reading would be. So, what is blood pressure? Well, blood pressure is the force of blood against the artery walls when the heart beats. Systolic, okay, so your systolic number indicates when the left ventricle contracts to push the blood into the arteries, and the diastolic indicates pressure on the artery walls when the left ventricle relaxes. So when somebody tells you your blood pressure is 120 over 80, that systolic number is the first number and that diastolic number is the second number. So normal blood pressure ranges, a normal systolic, so that first number is going to be less than 120 millimeters of mercury, but a healthy range is 100 to 140. The normal diastolic, so the bottom number, is less than 80 millimeters of mercury, but the acceptable range is 60 to 90. The difference between the systolic and the diastolic number should be between 30 to 40 millimeters of mercury. And so, where do these numbers come from? Well, if you look at the picture, this is the dial that you are watching as you are listening for the people's heartbeat. And so, that top number is going to be anywhere from ideally 100 to 140. That is when you first hear the heartbeat. And then when you lose the heartbeat, that number is the bottom number, and that should be 60, between 60 and 90. So, blood pressure factors, a couple of things that can influence readings of this are the force of the heartbeat, the elasticity of your arteries, and how much blood is in your arteries. And your reading actually does change by your position. So, whether you're sitting, standing, your legs are crossed, not crossed. So, ideally, we all have good blood pressures, but sometimes we get hypertension, which is it's a reading over 140 over 90. Okay, now this might be caused by excitement, anxiety, tension, stimulus, exercise, diet, smoking. It might be you're really anxious to go to the doctor and they take your blood pressure and it's really high, but once you've kind of calmed down and been there, they might take it again and then it might be in the normal range. Results that you can get this from: stress, anxiety, obesity, kidney disease, vascular conditions. So it might be kind of a one-time thing, but you could also have hypertension. So you could have prolonged hypertension, so then someone would say, well, they have high blood pressure. If you're not quite in those ranges, but your numbers are higher than that 120 over 80 consistently, then they might classify you as pre-hypertension. So you're not diagnosed with having high blood pressure yet, but you're on your way. Hypotension is the opposite, and so that is when you have a low blood pressure. So a reading that's below 100 over 60. Causes could be, again, rest, sleep, shock, depressants, blood loss, maybe you've been fasting. Sometimes this happens like when you quickly change your position. So, for example, if you've ever like stood up really fast and you kind of get lightheaded, your blood pressure just tanked for a minute there, and then it kind of figured itself out and went back to normal. So I know that's definitely happened to me before. So hearing a blood pressure. So we call these carrot cough sounds. So when you are taking the blood pressure, you're listening for the heartbeat. And so K sounds, I'll just call them. It's the tapping sounds you hear with your stethoscope. So you pump up the stethoscope and then you listen for that as you gradually deflate the cuff. And so it kind of goes in different phases. There's about 5 different phases that you hear, and you can see them detailed out. But if I'm being totally honest, I think it like starts really strong and then it gradually kind of just gets fainter and fainter as you release the cuff. So what are those different phases? So phase one is it's kind of the first time you hear very clear tapping sounds. Okay. Then phase two, sometimes it's a brief period may follow during which the sounds soften and they might have more of like a swishing quality instead of a tapping. Sometimes there's the escalatory gap where you lose the sounds altogether. And so if you're not aware of that and then you lose the sounds and you let out the cuff right away, you might have missed the accurate blood pressure because then, and again, this is sometimes, so this is not in all patients. In phase three, you hear the sounds In phase 4, they become kind of muffled. They're getting harder and harder to hear, more faint. And in phase 5, that is where you lose it, and that is that diastolic pressure. So it just kind of goes through these phases. I think the gap is really important to know, though, so that way you kind of don't jump the gun and let out the cuff. And you'll see what I mean when I show you a demonstration video. So let's hear what this sounds like. See if you can follow along here.
Use 114 over 76 as an example.
So the first time you hear the beat, notice what number it's at, and then when you lose it.
Alright, so now that you know the basics, let's try a few simulations. Listen closely and write down your answers. I will reveal the correct answer once the simulation ends. Here's the first one.
Okay, so they're not going to kind of put the marks on there so you guys see when you hear it and then when you lose it.
Try another.
So that one is quite high.
Let's try one more. So, did you answer all of?
All right, so hopefully you were able to hear those K sounds, which is really just the heartbeat that you're measuring, and hopefully you guys were pretty close. When you're learning how to take blood pressure, it can be kind of tricky to be able to hear that because sometimes, as you heard, it's pretty quiet, and then it gets a little bit more intense, and then it gets quiet again until you lose it. So, taking a blood pressure. So, we know what we should be listening for, but then how do we actually take a blood pressure? Well, you need a couple tools like your blood pressure cuff, the dial, and then the stethoscope as well. That sphygmomanometer is pretty much like it's the dial and then the air pump right there. So, I'm going to have that nurse that talked about respirations show you guys how this is done and demonstrate.
Here we have our patient. It is my awesome husband, Ben, and he is here to be my test dummy for doing our blood pressures. So the very first thing you want to do is you want to have your patient set down. And if they've been running around or really anxious or talking, you want them to be calm for at least 3 to 5 minutes before you take their blood pressure because you want to get the most accurate response. Then you will have them have their legs uncrossed and have their arms down by their side. And you want to ask them what arm you can take their blood pressure in, because a lot of patients have preferences on what arm you can use, especially if they've had an AV shunt or a blood clot in the arm or a mastectomy. You would never want to take a blood pressure in that arm. So I'm going to use Ben's left arm. You want to get your manual blood pressure cuff and your stethoscope. And what we're going to do is we're going to put it on our left arm, and on your blood pressure cuff, you have little arrows that say left and right. These arrows are meant to go over the brachial artery. So we're going to slide our cuff up through the brachial artery, and I'm going to just feel on his brachial artery where his artery is. And it's always on the inside of the elbow, and always have them bend that arm up really good because it pushes the pulse up, and he has a really nice one right there. So what I want to do is I'm going to take where it says that left arm arrow, and I'm going to put it right about 2 inches above that artery. That's where you want the cuff to rest, above the elbow, about 1.5 to 2 inches. And you always want to make sure that your cuff fits the patient. You have really small patients, and then you have some obese patients who would need larger or smaller cuffs. And to check your cuff size, use 2 of your fingers and just slide it underneath the cuff. Make sure it fits good, not too snug, not too loose. Because if you have a blood pressure cuff that does not fit, you will get an inaccurate reading. And this cuff fits him great. So we have that. Now what we're going to do is we're going to get our sphygmometer, and we're going to just clip it here. You can do whatever you want with it as long as you can see it, because this is going to tell us everything that we need to know for his blood pressure. Now what I'm going to do with my stethoscope is I'm just going to listen at that artery. And a lot of people, it really doesn't matter. You can listen with the diaphragm or the bell of your stethoscope. Studies have shown it does not matter. I like to use my diaphragm. So I'm going to place it over his brachial artery. Let me feel it again. Feel it right there. And now I'm going to close the valve on the blood pressure cuff, and I'm going to pump it up. You pump it up at least 30 to 40 millimeters of mercury of what they say that their blood pressure is. A lot of patients don't know what their blood pressure normally runs. So it's always safe to say to blow the cuff up to 180 to 200 millimeters of mercury. That's usually sufficient enough in a patient. So what we're going to do is we're going to inflate our cuff to that amount, or until we do not hear the brachial artery anymore. Like I said, we're going to inflate to about 180 millimeters of mercury. Then we're there, and I'm going to slowly release, open my valve, where it goes down at least 2 to 3 millimeters of mercury, just slowly. And what I'm doing is I'm listening for that first beat. That first beat will be our top number, which will be our systolic. And I'll tell you when I've heard it. We're passing 130, passing 120. And I just heard it just now at the 110 mark. I'm still hearing it. Still hearing it. And notice how it's ticking. See it a little moving up and down. Okay, and then it has stopped. It stopped at 62. So 110 over 62 is his blood pressure, and I've slowly let the air out. His blood pressure was 110 over 62. And always tell the patient what their blood pressure is, because a lot of people like to know. I know I've been in hospital settings and no one's told me what my blood pressure was, and I would have loved to know. And then of course take the cuff off of them. And if you have to repeat the blood pressure, you can do it in about 5 minutes. And it's good to switch arms. So thank you so much, Ben, for being my test dummy. And that's
All right, so that's how you take a blood pressure. So you know what? What's really the big deal? Why do you want to make sure that you have a normal blood pressure? Okay, between that 120 over 80 range. And so what's the big deal? So in Google Classroom today, I'm really just going to have you guys look up the health effects of, what happens long term if you have a low or a high blood pressure, and what does that start to affect in your body. So just hop on the question, read that, because it'll be a little bit more in depth than just this brief overview. All right.